guys, this is Dr. Rayleigh over at Incline Chiropractic, Colorado. Today I'll be interviewing Dr. Jessika Martin. She's a dentist and a local myofunctional therapist in Colorado Springs. Jessica, welcome and thank you so much for joining me.
Thank you for having me. It's a pleasure to be here.
Wonderful. So could you kind of just give us a little bit of a rundown exactly what it is that you do? I know that you're not just a dentist, and maybe also tell us about what myofunctional therapy is.
You bet. So my business is called Thrive. I am a general dentist, as you mentioned, and I have a heart to help new moms and their babies who are struggling with breastfeeding due to tethered oral tissues. So what that means is they either have a tongue tie or a lip tie or a cheek tie. We classify all of those into tethered oral tissues, and sometimes we shorten that to be TOTS, because how cute is that, right? I love to be able to catch these problems early because doing so helps you to set your baby up for success. So if these ties or TOTS remain untreated, then they can contribute later in life to speech problems, difficulty with eating solid foods. So you get your kiddos who love to eat nothing more than chicken nuggets and mac and cheese, as well as down the road dental crowding when you get teeth that come in, and even serious problems like obstructive sleep apnea. So being able to take care of a soft tissue issue when kids are days and weeks old, you're able to prevent some pretty serious things later in life. A myofunctional therapist is something that dentists, as well as dental hygienists and speech therapists, are able to pursue. It helps you to learn much more about the muscles of the face, the jaw, the musculature that's required to eat and chew and speak effectively, and really the work that's necessary to properly balance those muscles and provide you with a tool set to be able to have the best growth pattern for forever.
So just to have a better understanding, you're a dentist that doesn't necessarily work with teeth. You more so work with mothers and babies that have lip tie, tongue tie to kind of fix the problem and allow for easier breastfeeding. Correct? Is that correct?
That is absolutely correct. So with Thrive, that is my primary job, is to deal with soft tissue, to deal with these ties. As a general dentist, I also practice as an associate in a practice doing traditional dentistry. So your fillings, your crowns, that sort of thing as well.
So your business is Thrive Grow Colorado, and then you also work as an associate outside of your practice. But you practice inside of the birth center, correct, in Colorado Springs?
I do. Yes. I'm at Beginnings Birth Center. That's in the area of Briargate Parkway and Chapel Hills. It is a fantastic place. When you walk in there, it's like you're just walking into somebody's home. Their team is absolutely incredible, and it's a privilege to be there.
Yeah, they are. They're a great group of people to work with. So how long have you been a dentist, and how long have you been a business owner?
So the business I developed about 3 years ago, and I have been a dentist since 2016. Prior to that, I was a dental hygienist for about 10 years, and prior to that, I was an orthodontic assistant and helped with admin in the dental office as well. So dentistry has kind of been my life for a really long time.
So when did you decide to kind of branch off and do your own thing and work specifically with moms and babies?
That's been in the last 2 years. I sought out some continuing education on tongue ties and lip ties and how to go about treating those effectively from the start in a way that is the most predictable. So often that means that you're working with way more than just a dentist. There's body workers like chiropractors and craniosacral therapists. There's also lactation consultants, IBCLCs. They're just huge when it comes to helping to diagnose and then navigate those moms and babies to the right people.
Yeah, sometimes it takes a team in order to get things done. I know that in my chiropractic office, I'm allowed to kind of catch the signs and the symptoms of, why is baby not breastfeeding? Maybe it's not the problem that they're having with their neck that we originally thought, and maybe it is lip tie, tongue tie. So I can take a peek in their mouth and kind of see if I think that that's something that they're dealing with, and then I can refer them out to wonderful people just like you to work with them. So what are you doing right now since all this COVID stuff's going on? I know dentists are really only allowed to see emergency patients. How has that kind of affected you?
So in the traditional practice, we haven't been seeing patients for over a month at this point. So I've been spending a lot of time at home. Some situations really are emergent. If you have a child who is failure to thrive, that is an emergency. So there are some cases where I've been able to just make it into the birth center. That looks very different right now than what it did months ago. So instead of being able to have both parents present or even siblings present, it's one adult per baby. So if the other parent in the relationship wants to be present, we end up doing that with like a FaceTime or some other video chat where they're able to be as present as they can be. You go straight back to the treatment room instead of being able to hang out in their beautiful waiting room and enjoy their coffee and tea. And we have you text me when you get there so that we come and get you straight from your car and we just go straight back. The dental profession overall has been quite safe since we started wearing gloves. We follow OSHA guidelines very closely. We really have a high standard of cleanliness. So yes, there's been more implementation of protective equipment, but really the dental field has been pretty tidy as of the past couple of decades, certainly.
Yeah, and I have been told that some people have gone to the dentist since the stay-at-home orders kind of lifted. I don't know about up in Springs. I know down in Pueblo they are able to see their dentist, and they have everything on. They got goggles on, they got their hair covered, they got their mouths fully covered, necks covered, arms are covered, even the shoes are covered. So are those some of the precautions that you're taking?
Yeah, those are precautions that are being taken, certainly in environments that create aerosols, like where you're using a high-speed handpiece. So definitely in the traditional dental setting, but we are very careful at the birth center as well, being very protected and covered.
Yeah, same in my office. I wear the gloves and the mask and everything, and asking patients to wear those as well. So, um, let's see. Okay. So, what is the best way to contact you right now for people?
Sure. So there's a few different ways that you can go about reaching out to me. Oftentimes, like I said, you find me through your lactation consultant or a body worker. But one way is to actually call the birth center directly, and that is Beginnings Birth Center. Their phone number is 719-367-9405. You can also email me. It's Dr. Jessika at thrivegrowco.com. Have to be a little different, so my name is spelled with a K, so Dr. Jessika at thrivegrowco.com.
Wonderful. And I'm going to just take a shot in the dark and say that you don't take walk-ins and that appointments are kind of necessary.
You'd be correct in that shot in the dark. I don't take walk-ins. Appointments are necessary. That is definitely true. You can plan on spending about an hour with me when it comes to the evaluation and consultation. And that allows me really to be super present and focused on you and only you, and not distracted by other people who I also absolutely want to be able to help. It lets me focus much more. It's a better way to go.
So what is the procedure that you have for those kids that are getting their lip tie, tongue tie taken care of?
So the procedure, I use a CO2 laser. It's only for soft tissue. So there are many different dental lasers. Some are meant for hard tissues like bone or tooth. Some are meant for soft tissues, and others are meant for both. I use a CO2 laser, which is the kindest and gentlest to the tissue. It allows me to be very specific and focused in what I'm doing. So basically we bring baby back, and we use a swaddle me, little swaddle, just like you would have at home. And we place some topical numbing. It's a paste actually, because we don't want it to trickle down their throat. And after that, we let that sit for about 3 minutes, and then we are able to bring baby back, let them lay down, and they're not restrained outside of wearing a swaddle. Everything is very gentle. My dental assistant also absolutely loves babies. So if baby starts to cry or get upset, we just stop and we just hold the baby and cuddle and bounce and have fun, and then we get right back to it. So basically, you're oftentimes away from baby for up to 15 minutes, but the procedure itself takes seconds. So a cheek, you're looking at maybe 1 to 3 seconds, a lip, maybe 3 to 5 seconds, and a tongue, maybe 5 to 15 seconds, depending on how severely tethered those tissues are. And that's it. There's generally minimal bleeding, if any. The healing is a hard part. So you think that you go in and you have this magic wand experience and everything's immediately better. And for some people, things really are a lot better immediately. And for half of the people, it's not. It takes time to get better. And it takes sometimes the help of the body workers and the lactation consultants. So I tell people to plan on that the following week. That's how you're going to get the best success, without question.
And you see a lot of success with this, I'm guessing, because I mean, I know a lot of kids have trouble with breastfeeding, especially if they have that issue going on. I had one family that their baby's teeth had turned brown, and it was because from nothing more than having a lip tie. And the whole, myofascial, the whole posterior chain kind of got affected by this. And once they got that situation fixed, the baby's face had completely changed. It was incredible, and everything was so much better. So you see a lot of success with what you do.
Absolutely. So it's really important to me to follow up. So after the procedure's done, I tell moms that they can tell me if I'm driving them too crazy. So I talk to them that afternoon. I talk to them again that evening. I'm reaching out the following day, and then 2 days later, and then 2 days later again. We do post-op visits. Right now, those are via Zoom, just to keep everybody as safe and at home as possible. And then we sometimes, when we're not dealing with COVID, we have in-office post-op visits where I'm able to look at everything. I always go through a questionnaire to determine how much success we've had. So has there been improvement in all of the issues that you came in with? Some of them, most of them. What can we do to get you to the endpoint that you desire? So I always take into consideration what their initial concerns were and what their goals were, and have we met all of those?
Great. So what sets you apart from other professionals that do this? Because I believe there are EMTs, some EMTs can do this. I know some dentists out there that treat everybody can also do this. So why would people bring baby into you?
That's a really good question. I'm a mom, not that gives me credibility there, but I have a daughter who had a tongue tie, and she is 5.5 now. I didn't know at the time that she had a tongue tie. So she really struggled with breastfeeding. I really struggled with breastfeeding. We kept it up, but we didn't know that there was help out there. So I have a personal interest in it without question. I spend a lot of time with my clients. So first we talk on the phone for about 30 minutes before we even meet in person, where I'm able to go through their concerns, hear their birth story, really just make sure that they've done all the things that are necessary before they get to see me. After that, I follow up several times, like I had mentioned just a minute ago. Each client gets my own personal cell phone number, and they are told they can't wear that out. So if it's 2 a.m, I don't care. Reach out to me. If you're scared, I understand. Call me. It's fine. In addition to my time, I have a real dedication to collaborative care. That's how I said we get the very best result. So I communicate with the other members of the team, whether that's chiro or craniosacral or lactation. It's really important that all of those parties that got you to my door in the first place are in really good communication, because if not, we all look at things with different lenses. So what I see might be coming from a background of dentistry, but what you see is not from that same background. So we might be looking at the same thing and seeing them very differently. So I really appreciate the perspective of other professions. In addition to that, I have experience with myofunctional therapy, so I have a high level of understanding as to how things go together and how they should.
Yeah, so not just the, fixing of the anatomy problem, but also kind of working with the muscles afterwards. So, and I mean, it seems like you obviously really care about babies and moms since you work at the birth center. And I love the fact that you said that if the baby's crying, you pick them up and you console them. Because I know working with kids, sometimes it can be frustrating. You have to have a lot of patience and love for them in order to get things done in a good way. So
that's true.
So how about insurance? So do you take insurance? Is that what parents normally do whenever they come in to see you?
So I am payment at time of service. However, I will provide families with written information on how to submit for their own insurance. So if they choose to submit to their medical insurance, is great, because these moms have often just had the babies, so they've met the deductibles that they've needed to, and they're able to go through and they're able to submit to their own insurance. And if they have any issues, then I'm able to help provide them with any additional information they need. But that takes some definite additional manpower, and I like to be able to keep things as small as possible and pure as possible. So I am able to give you the codes, but I don't do the submitting on my own. So you may or may not have coverage, payment at time of service.
Have you noticed one insurance company over another, or ones specifically just really don't want to pay for it, ones that are definitely willing to pay for it?
No, that's a question I should add to my follow-up questionnaire, is if people were able to get reimbursement. I haven't really followed up on if that has worked out well for people or not.
Yeah, and I think for the most part, this is something that's very necessary. Anybody out there that's watching, if you even think that your child has a lip tie or a tongue tie and it could possibly be contributing to what the breastfeeding results are that you're having, it's definitely worth it. There's really good results, and Dr. Jessika is a wonderful resource for you. So let's see, do you have anything else that you would kind of like to tell everybody that we maybe haven't discussed today?
I guess we probably touched on it briefly, but we had talked a little bit before this about what is an ideal client or patient or customer. So for me, that's probably the most important thing. So ideally, you don't just see a video and call the birth center and say, hey, my baby has a tongue tie. I saw something on Facebook and I know, because sometimes that's not right. So I believe that collaboration is the key to success. So working alongside the lactation consultants and the body workers has been foundational for me. These co-therapies let me get the very best result possible, and it gives you a team. So when you walk away, and no matter how much we've gone through things, you're not going to remember everything we say in the consultation. So you have a team of people that you can reach out to and be like, hey, am I doing this right? And we're able to, whichever modality that you need, we're able to have that team of support members right there with you. So for me, generally speaking, I will not see somebody before they've seen a body worker and lactation, because not oftentimes, but there are times where you can have the problems resolved without even coming to see me. So something that you might think is a tongue tie or a lip tie could be positioning, or it could be tension in the floor of the mouth, or it could be this deep frontline fascia that is connected from your tongue all the way to the tip of your toe. If you have tension in that area, that can be released with chiropractic or craniosacral therapy, and you go and you get your tongue revised, but that tension's still there, we haven't provided you a service. So I think that the more knowledge that we have going into it, the more co-therapies that are sought out, the better the success.
That's wonderful to know. So who would you recommend that they go to first? The lactation specialist, and then there was one other that you had also suggested.
So lactation, I would say first. That's something where if it's positioning, oh my goodness, how simple is it to fix that? It can be maddening. You think that breastfeeding it's natural, it should be simple and easy, and it's so not. It's so not. So lactation is definitely the first line, and then after that, there are some really incredible lactation consultants in the Colorado Springs community, and they are very aware of co-therapies. So oftentimes the lactation consultants will refer not just to me, but also to chiropractic or craniosacral therapy. So that is, I don't know, that's an amazing way to go about it. I don't know if I answered your question though.
No, you did. So just kind of the chain of, like, where should we go next? Lactation
Sure.
specialist didn't help. So now where do I go? So,
Yep.
like I said, if I see a mother that comes to me that's maybe struggling, I'll check that. And if I think that there's even possibility of that being what's going on, I'll refer them to someone such as yourself that could give them a diagnosis, or at least give them peace of mind that that is not something that they have to worry about.
Absolutely.
For the mystery question, let's go with name 5 uses for a brick other than building with it, like laying them and layering and using it as a paperweight.
Oh my goodness, you took away 3 really excellent options. Thank you for that.
Those obvious ones.
So you can set it on your computer to get the right angle to be doing these Zoom meetings. That would be one. You can, that's one. We are a fifth of the way there.
Okay, I'll give you one. We could share it. How about that?
I think that's a great idea.
Okay, how about using it to like smush stuff with, like a bug or something?
Yeah, absolutely. Or an avocado. We could go some guacamole with brick.
Hey, there you go. That's 3 uses right there.
Okay. If it's out in the sun, you could, it'd have to be pretty hot. If we were in Arizona and it was out on the sun, you could cook with it.
Okay, I like that one.
All right, this is collaborative care right here. What's your 5th?
Okay, so the 5th one, how about let's just go with generally just breaking stuff.
Perfect.
Yeah?
Yes, I like it.
Okay, awesome. Well, thank you, Dr. Jessika, for joining me today. Everybody else out there, be well and stay healthy and have a wonderful day.
Thank you.